Hello everyone, my name is Anna Rodriguez. I'm here with Alexia Nitkowski, and we're going to be talking about the case presentation for King Triton in The Little Mermaid. A brief description of our subject: his name is King Triton. He's from the movie The Little Mermaid, and he's the ruler of Atlantica, an undersea kingdom inhabited by mermaids and mermen. His role as king is to rule over the seas and protect his citizens from harm. He is misanthropic, meaning he dislikes humankind for the potential dangers to his people. His late wife also passed away due to an accident with a human pirate ship, which could suggest why he hates humans. One of his 7 daughters, Ariel, takes a liking to all things human. She collects human objects and observes people from a distance. It is said that Ariel is Triton's favorite daughter because she reminds him of himself, a strong-willed and independent mermaid. This leads to constant conflicts between the two, as Ariel is constantly testing her father and is forbidden of making any sort of contact with humans.
Moving on to diagnosis, we diagnose King Triton with PTSD, or post-traumatic stress disorder. How does cultural context impact his diagnosis? Well, King Triton is considered regal, and he is expected to be perfect. His reputation precedes him, and if he was diagnosed as clinically ill, it would cause a lot of views to shift. For such a high position of power, his subjects expect him to behave almost godly. Additionally, because he's a man, he's also expected to not have fears and behave relatively stoic, as it can be interpreted as an indication of weakness if he were diagnosed. Thus, this causes King Triton to not address his past trauma or get help from those around him. If he were to, which would be abnormal, Triton would possibly be diagnosed with paranoia for the unknown, aka human world. Now, is this disorder diagnosed in all cultures, and what stigmas are associated? No, this disorder is not diagnosed in all cultures. People with PTSD take a very long time to resolve their condition, if they ever do. Nonetheless, many do not understand the fears that stem from trauma and how it takes time. Patients cannot just simply get over it. Furthermore, many people also consider this condition to be specifically related to military means, but it's not always the case. The traumatic event doesn't necessarily have to be inflicted on the person, such as how King Triton was not directly inflicted. Additionally, many diagnose these symptoms as anxiety or bipolar disorder instead of PTSD. Our first symptom is irritability and aggressive outbursts, which is shown through excessive emotional distress as something that reminds him of a traumatic event. Our second symptom is isolation or detachment of things that relates to traumatic events. The examples that we've seen in the movie is when he destroys the human creations that Ariel has found and hoarded. He also forbids her from going to the surface and makes sure to detach from anything that's related to the human world. In particular, he forbids Ariel from not seeing the seagull. King Triton gets beyond aggressive when he discovers Ariel's collection of human items. He gets so angry that he destroys all of Ariel's collected items that took years to accumulate. This is a symptom of irritability and aggressive outbursts. This outburst stems from fear of humans due to past traumatic events such as his wife's death at the hands of humans. Due to this, he is excessively protective of Ariel compared to the other sisters, as Ariel reminds him of his wife and a little bit of him. Psychotherapy and medications are 2 common methods of treatment for PTSD. I would use exposure therapy to treat King Triton. Exposure therapy is a type of behavior therapy that helps the patient face both situations and memories that the patient finds scary to learn how to cope effectively. It is also helpful for flashbacks and nightmares. I would recommend this because it will allow King Triton to learn how to cope with the recurring human items that sinks to the bottom of the ocean. Additionally, it would allow King Triton to strengthen his cognitive patterns to improve and alter his reaction when faced with human items that could stimulate his trauma. However, potential social and cultural barriers that might hinder him from getting proper treatment is a requirement of a therapist. While individual therapy would be better to help King Triton focus more on his exposure to his traumatic event, this still requires a lot of time and effort. As a king, he has other priorities, and oftentimes mental health is placed on the back burner. Additionally, as someone who dislikes feeling weak and is expected to be perfect, looking for help would be a very difficult task.
Looking at it from a broad perspective, The Little Mermaid does a good job of portraying the disorder. Though King Triton is not the main character, we see how his disorder creates a dysfunctional relationship with him and his family. This film mainly highlights the symptoms of PTSD and its effects on others, though since he is a father and king, his behavior is almost justified because he is a man. Sebastian, the king's advisor, defends King Triton's outburst and urges Ariel to follow his orders. The media in general portrays PTSD and post-war individuals in extreme cases. However, there have been a few films that pertain to a broader group of individuals. Movies like Brothers, a film about a soldier who comes back from war, depicts the effects of extreme conditions on a man and his family. Films like Perks of Being a Wallflower and Room, however, shows the PTSD effects of sexual abuse and child abuse on women, something that hasn't been talked about as much in the past. Our own understanding of PTSD has been more accepting as time has gone by, thanks to film that characterized PTSD rather accurately. This is our We're Excited page, and with that, we thank you for your time and we hope you enjoyed our presentation.